I graduated from Edinburgh University and did my foundation jobs in Edinburgh, and I wanted to be a medic all throughout med school really, until as a foundation doctor I did a couple of months in the vascular surgery ward as part of my acute surgical job and saw a very cool operation in Edinburgh. It's the Centre for Thoracoabdominal Aneurysms, and I was able to take a peek into one and thought it was really unbelievable. And I remember thinking at that moment that it was a bit of a moment for me, that it was unbelievable what the surgeon was doing, so replacing the whole aorta with a tube graft. And that was the moment I thought that it would be pretty cool to be a surgeon, to be able to fix something. So from that point on, having tailored everything in med school towards medicine, I suddenly did a U-turn and started to find out what I needed to do surgery. Did some surgical projects and got my training number. So I got a core training number in Bristol, which wasn't my first choice, to be honest with you. I wanted to stay in Edinburgh and I wanted to get a run-through general surgical number, which still existed at that point, but I didn't get it, and I thought that was a total disaster. But it turns out that going to Bristol was the best thing that I could have done for my career and for my personal life, because I met my husband down there and I worked in the vascular department in Bristol, and that really cemented my interest in vascular surgery. So that was a good lesson to learn, that things often work out differently from what you expect, but in a good way. And after that, I got my training number, my ST3 number in general surgery, and that's before vascular was its own specialty. That was in southwest London, so I spent about 18 months down there doing general surgery and a little bit of transplant. Then came back up to Edinburgh for a PhD and switched to the vascular curriculum and transferred deaneries. So I'm now almost an ST8 in Edinburgh, coming towards the end of my training, having worked in a couple of different places, and I think probably my training's been all the richer for that. So in my head, I like to run and cycle, and in reality, I do like to do these things, but I've not got as much time for them at the moment as I'd like. So I also have a young family. They take up quite a lot of time, and I guess at the weekends, quite a lot of time is with the family and going to people's houses for dinner and just sort of having a nice, relaxing time. Well, I don't think I do it all that well all of the time, but I think it's about recognising that there's a time for everything really in life, and we're probably all really keen on doing everything all at once. For me, it's been a hard lesson to learn that there's sort of seasons for everything. You know, at work, there are often times where things are quite intense, like studying for the FRCS earlier in the year. And now that that's done, there's lots of other work things, but I've also got to kind of be there for my family a bit more. But just recognising that there are times where you will be present more and times where you'll be present less, and that's okay, because it's possible to do everything, but probably not all at once. I really enjoyed it, actually. I went into kind of in a box ticking exercise, not really knowing, not really thinking that I wanted to do academia long term, and thought I'd probably just do an MD. But I really enjoyed it. I worked with Professor Newby up in Edinburgh, who's quite a prolific cardiologist, and you know, he's had so many PhD students through his lab. He's very successful and a fantastic supervisor. And it was really difficult to get used to the move from clinical to academic and the dramatic change in the pace of life. And you know, you go and do an operation, you see an instant result, whereas in academia and during PhD, everything takes forever. You know, one piece of paperwork takes 5 weeks to complete. So that was frustrating. In the end, I really liked the fact that I was contributing even a tiny bit to knowledge and to knowing more and asking questions. And I suppose that's what stayed with me, is asking the questions and trying to find the answer rather than just accepting things that you're told. So I really enjoyed the PhD, and I try and do a bit of academic work on the side as well as my full-time clinical job, and hope to have some academic time as a consultant. But it certainly is a change of pace, and it's not for everybody. You can't really turn off from it, and I know we all work hard and longer hours in clinical than we should, but with research, you know, there's always something you could be doing, always another paper you could be writing or reading, and come home after a day at the office and think, you know, there's still a lot going on, and it's hard to switch off. I think that's the most difficult thing. But it's great, and it's a bit of a change of pace for a few years as well. I didn't do any fixed clinical commitments, so my life was kind of just, it's quite easy for a few years, and it was very flexible. I could fit it around having a baby and things like that. So I really enjoyed it. So it's a bit variable, but it's a good mix of clinics, which I think are very valuable. I know we all want to be operating all the time, but actually clinics are where you see the slightly random things that come from the GP that as a consultant you'll have to be faced with and manage in sort of chronic setting. So maybe a clinic a week, maybe a full day clinic or half day clinic a week, a couple of operating lists a week, mix of all the big cases, aortas, fempops, fistulas, all sorts of things. A day in IR, so we've got dedicated IR sessions for vascular trainees, and then usually there's MDT thrown in there as well. So typically there's something on every day, and there's not a lot of downtime, and there's a lot of operating for us, which is great actually. So I think the best thing about vascular is it's very varied. So one minute you'll be doing this tiny little operation with a pair of loops on a fistula at the wrist, and then next on the list there's an aneurysm, open aneurysm, and a carotid. It's every part of the body really. And from that point of view, I think it keeps it really interesting and varied. It's not just one operation after one operation again and again. So I think it's the variety and the challenges, and the fact that it's often, you've got to think on your feet, you've got to have a plan B to Z, because things often don't go as planned. And it's quite creative in that way as well. So yeah, I think those would be the things that are quite attractive as a specialty. Challenges, the patients are challenges. They've got lots of comorbidities. And I think one of the most difficult things is knowing when not to do something, because often there is a solution of sorts. You think of how to revascularize, but when it's appropriate and not appropriate, and sometimes having a suboptimal solution for a patient who's maybe not fit enough to have the big bypass procedure that they would ideally have. So I think it's the decision making in those grey areas that's difficult in our very challenging group of patients. And I think the worst thing in medicine and the most difficult thing in medicine is to do nothing at all. So when the rupture comes in, who's not the fittest, to have to say to the patient, we can't do anything for you and you're going to die, it's really hard. And I don't think I've mastered that at all yet. But the surprising thing is that often patients are okay with that. Say, well, I've had a good life doctor, and they cope with it better than we do. So I think that's a challenge as well. I think it's important to remember that everyone does not follow the same route. There are many paths to being a consultant surgeon. If you're interested in surgery, have a try of all different specialties. Never discount something until you've held a knife and done a part of an operation. For me personally, there have been a couple of key moments along my career where I've been discouraged, whether directly or indirectly, against being a surgeon by some quite sort of well-known important people. And it wasn't in an act of defiance that I thought, well, I'm just going to do it anyway. I just really wanted to do it. So I thought, well, I'll just see what happens and give it a shot. And it seems to have worked out okay so far. So I would say just keep going. It's tough. It's a bumpy road at times. But don't just give up at the first hurdle. There are people who will try to give you advice that they may think is helpful, that's quite negative. But if you want to do it, just keep going.